Welcome to Penrose Learning, where we make understanding easy.
You must begin by involving a licensed veterinarian. Do not attempt any surgical procedure yourself. Once booked, explain why you want the procedure and ask about timing, expected outcomes, and pain protocols. Make sure the vet documents legal consent and reviews the dog's vaccination status and medical history. If the vet recommends against docking, make sure to understand their rationale and alternatives. This protects the dog's welfare and keeps you within legal and ethical standards while starting the process correctly. The veterinarian will perform a full exam and pre-op tests to minimize anesthetic risk. This is why you consult a professional. Once cleared, the procedure takes place under general anesthesia in a sterile setting, with trained staff monitoring vitals continuously. The vet will explain the chosen surgical technique and provide an analgesia plan that covers intra-op and post-op pain control. Make sure to get written aftercare instructions and a clear timeline for stitch removal and follow-up checks before you leave. Recovery focuses on preventing infection and managing pain. Follow your vet's medication schedule and activity restrictions precisely. Once home, keep the incision clean and dry and use an e-collar as recommended to prevent chewing. If you notice progressive redness, foul discharge, fever, or the dog becomes markedly lethargic, contact the clinic immediately. Do not apply home remedies or attempt resuturing. For one key troubleshooting tip, if heavy bleeding or sudden collapse occurs, seek emergency veterinary.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.